Joining me now is Congressional candidate for Texas's 31st district, Dr. Eady Mann. Thank you so much for joining us.
Thank you for having me tonight, Anna.
So you are running for the 31st district in Texas. This is actually not the first time you ran for this congressional district. You actually ran previously to unseat the Republican Congressman John Rice Carter. And so tell me what happened in the previous election and what are you doing differently this time around?
In the previous cycle, I made it into the Democratic runoff with MJ Hagar, who decided then to run for Senate. And so we really are picking up what we did in the last cycle, building grassroots networks, making sure that we have the resources that we need to take on an entrenched Republican like John Carter. He's been in office now for 18 years, ever since the district was created. It was created for him. And so we're building on the networks that we created last cycle. We've done voter registration. We have joined groups throughout the district to make sure that they know that we are running this race again. We brought in a team of local activists, people who have worked on Beto's campaign and other campaigns across the state. And so we've just got a really robust campaign going on, and we're going to win.
Absolutely. You are incredibly strong on the issues. You come from a very progressive perspective on healthcare, which I want to delve into a little bit. So you're a successful physician, and usually when it comes to people who work in the healthcare industry, I mean, as a doctor, I'm always curious what the perspective is of physicians. Single payer healthcare has been smeared over and over again in the mainstream press, but you are supportive of single payer healthcare. Why is that?
Well, I've been supportive since 2009. I started speaking in favor of universal coverage and single payer back when the Affordable Care Act was being debated. And have been an advocate for that ever since and haven't changed that stance at all. And the reason is because as a primary care doctor, I see what happens to people when they don't have care. Just this week, I had a woman who came in who has diabetes, and she didn't have care for 2 years because she did not have insurance coverage. And she's starting to have complications from diabetes because she didn't have her sugars controlled, couldn't afford her medicines, couldn't see a doctor. And I've been watching that happen for 2 decades. And I am tired of watching from the outside, seeing that happen. What I've learned over the past several years is that through my activism in other areas, working on the outside makes you feel good, but it's going to be more effective to be in Congress in a legislative position to be able to move the policies forward that we need to protect people. There should be no question that every American should have coverage for healthcare from the minute that they are born till the minute that they die. No questions asked.
Absolutely. Oftentimes, especially when it comes to a general election, I think that voters tend to think that's the most important election to focus on, but really that's just the executive branch. You still need to have empowered progressives in Congress who are actually going to help, let's say, a progressive president execute some of these proposals, and of course, single payer would be one of them. So can you talk to me a little bit about what your thoughts are on a public option versus single payer healthcare? Because there's an argument from some of the more centrist Democrats in Congress in regard to a public option and how they think that would be a better way to go about reforming our healthcare. Do you agree?
It's really frustrating for me, and watching the debates going on and hearing from my own side that we are willing to accept something that does not cover everybody. Mm-hmm. And that has always been my bottom line. The program needs to cover every American without gaps in care for pre-existing conditions, or because you lose your job, or because you want to start your own business. There just should never be a gap. And that's my concern with other plans, is that we're going to have a gap and we're still going to leave people out in the cold without that coverage. So I'm going to push for the most robust plan that I can get past. With my bottom line, my red line is universal coverage.
Some might argue that in a state like Texas, and I know it's quickly becoming blue, it's really a purple state at this point, but some might argue that it's tough to get some of the conservative voters in your district on board for something like Medicare for all. What's your response to that?
Well, first of all, you do not have to get every Republican on board to win in a district like mine. If you have all of the Democrats on board, you only need a percentage of Republicans to get across the finish line. And in surveys that we do, about 23% of Republicans are in favor of a government plan for health care. So it is not a losing argument. It is something that we can build on from a Democratic perspective and bring in those people who are open to it on the Republican side. And there's actually higher numbers in the independents. So
yep.
I've been doing this for a long time and explaining to people for a long time why this is so important. And I'm going to continue to speak out. And I know that we can win. This is not an issue that's going to lose an election.
I love it. We're speaking with Dr. Christine Eady Mann. She's running for the 31st district in Texas. And I want to just touch on a quote that I read of yours that I thought was powerful and it was incredibly impressive. You said, "I've had many patients say, why? Why would you do this? Why would you put this time and energy in? Why would you want to go into Washington, into that swamp and that quagmire?" And I ask them, are there still children in cages on the border? And I thought that was a powerful statement as someone who wants to be part of Congress, someone who's from Texas. So can you elaborate a little bit on your thoughts on immigration policy?
Yeah, so I spent time at the border earlier this year. I volunteered at a clinic and shelter for asylum seekers who had just come out of Customs and Border Patrol custody. And this was right as the Remain in Mexico policy was going into effect. So during the week that I was there, I was able to meet with people who had traveled thousands of miles, leaving everything that they had, selling everything that they owned, to come and seek refuge in the United States. And when that policy went in place and we started sending people back over into Mexico, we didn't know what was happening at this clinic that I was working at. So I traveled into Nuevo Laredo to try and find out where these immigrants were ending up. And it was horrible. We saw children sleeping on the streets, pregnant women who had had all their medications taken away from them. And as time progressed, what we learned was that cartels would kidnap people who were migrants. They would use them for human trafficking and try and get ransom out of their families. And so there's so many pieces to the immigration issue. I think we all can say that the system is broken, but there are some policies that have gone into effect under the Trump administration that are horrific. The Remain in Mexico policy is one of them. And there's another piece that I'm working on right now. I'm working with a nationwide consortium of people who help refugees who have been admitted from outside of the United States and have been allowed to come into the US. And as the Trump administration has reduced the numbers that are allowed, the infrastructure to support them has vanished. Mm-hmm. And so I am going to be meeting with state legislators this coming Friday to look at state level solutions, because Texas is a state that accepts a lot of refugees. And so what we're going to try and do is introduce legislation through Texas that can help maintain the infrastructure for refugees who are coming into the United States. And so we have all of these issues, all of these policies that are just not working, that are keeping people who have a legitimate claim for refugee status, a legitimate claim for asylum status, and we're turning them away and we're treating them like they are criminals when they are going through a legal process. So all of that needs to change.
So let's say in an ideal world you win and you want to implement these policies. I want to talk a little bit about how you intend to fight for them, because more often than not, unfortunately, some of these progressive policies get the most pushback from centrist Democrats in Congress. So what is your game plan to tackle these issues while fighting both conservatives in Congress and centrist Democrats?
So my point of view is persuasion. I think we need to reframe this debate and get away from using the word compromise. There's a place for compromise, but the job as a legislator is to persuade people. I'm very persuasive. My day job is to persuade people to get colonoscopies. So this is something that I have some negotiating skills in my back pocket for. And I've actually worked locally to be able to enact things that have been a public good. So when I first came to this district, I convinced the Round Rock City Council, a Republican mayor, a Republican council, to enact the city's first citywide smoking ban in restaurants and bars. And I didn't go in offering up all the concessions that I would make. I went in saying, this is what we need to do. This is why we need to do it. And let's talk about why we need to do it. And that's the approach that we need to be taking. Negotiation 101 is you walk in asking for everything that you want. And then maybe you compromise, but you don't walk in saying, we're going to come to the middle on this. You come in from a position of strength.
I love it. I love it. One final question for you. Thoughts on money in politics? How are you funding your campaign?
Well, so in the last cycle, I was very upset about the idea of money in politics. And I did no dedicated fundraising. I didn't hold any fundraisers. I raised $95,000 just through social media outreach and so forth. And I was not able to finish and win. So I decided this time that I would go the traditional route. I do fundraising. I have held some fundraisers. And my idea is that it has to be done right now because that is our campaign finance system. And so if I can get in Congress and change it, I'll take it. I will do what I have to do to win. As long as it's not unethical or illegal. And once I'm in, then I have that pulpit to be able to say, this is crazy. The way we fund campaigns is crazy. It's wrong. It gives an unfair advantage to people who already have money and who already have connections. And it disenfranchises people who are from middle class and lower income families who want to be involved in politics, and it needs to change.
Are any of your donors, big dollar donors?
If you call $2,800, which is the maximum as a big donor, that's the most money I've taken from any individual. I haven't taken any PAC money of any kind, even from PACs that would be considered acceptable. Most of my donations are in the $100 to $250 range, and then our average donation is right around $95 right now, and we've had over 2,000 donations. So there is a way to do it without going and asking for huge amounts of money, but the reality is these races are very expensive. And as progressives, if we want to win, we have to accept that that's the reality of the situation, do what we have to do to get in, and then we can change things.
All right, Dr. Christine Eady Mann, please check out more information about her candidacy by going to Christine4, that's the number 4, Congress.com. Again, that's Christine4Congress.com. And there's also the link that you can go to if you're interested in donating to her campaign, and also a link if you're interested in volunteering. Dr. Christine Mann, thank you so much for joining us. I really appreciate it.
Thank you for having me on. Have a good evening.
Like what you see? Click the subscribe button below and don't forget to ring the bell to never miss another video from the Young Turks.